Recognizing the member for Richmond South.
Thank you, Honourable Speaker. I'm honored to respond to the member's opposite statement. I want to express my gratitude to the member opposite for her comments, as we all have similar concerns for the lives and safety of Richmond residents. British Columbia, like other jurisdictions in North America, is facing numerous significant difficulties, including housing affordabilities, homelessness, global inflation, healthcare challenges, and unfortunately, toxic drug crisis. Our government is committed to reduce costs, ensure community safety, and saving lives of British Columbians. As MLA of Richmond South Centre, I witnessed firsthand the challenges that people in my constituency are facing. However, British Columbians are resilient and dedicated to securing a healthier future for all. Our government has implemented various measures to address global inflation. We enacted housing legislation and regulations to increasing housing supply while combating speculation. We significantly reduced ICBC rates for drivers. Additionally, we have eliminated bridge tolls, MSP premium, provide BC Hydro rebates, and reduced childcare costs for families in British Columbia. Nevertheless, the strong pressures of global inflation persist, and many are still struggling. Unprecedented environmental extreme weather events further exacerbate the challenges. Therefore, our government remains steadfast in fulfilling our promises to British Columbians by achieving our Clean BC targets. The COVID-19 pandemic has devastated the world as well. The lives of British Columbians has forever altered by it. The past few years were tough, yet British Columbia remains strong and resilient. Unfortunately, not all British Columbians are experiencing these global challenges equally. According to the BC Coroner's Services in 2023, another 2,511 British Columbians lost their lives due to the toxic drug crisis. These individuals are our brothers, sisters, fathers, mothers, sons, daughters, and loved ones. Addiction is a healthcare issue, and it is important that we work together to save lives. I want to take this opportunity to express my gratitude to our healthcare workers, nurses, doctors, and for their unwavering commitment to maintaining the functionality and strength of our healthcare system. They deserve to work in a safe environment where they can focus on delivering professional services without concerning for their safety and health. British Columbians who are required to access our healthcare system deserve to do so safely and comfortably. As a resident of Richmond South Centre, I raised my family in the very riding that I represent. My family and I often rely on essential services provided by Richmond's 2 UPCC, 2 urgent primary care centers, and Richmond Hospital. And I'm also glad our government introduced Foundry in Richmond to support mental health of young people between age 12 and 24. My loved ones, as well as everyone in Richmond, deserve safe access to health care. Our government has never lost sight of the importance of public safety in public spaces. Last fall, we introduced legislation to address issues with public substance use, but it has been held up in court. It has become evident that the court case will not be resolved quickly, and British Columbians do not want to wait any longer. Therefore, under the leadership of Premier and the Minister of Health, our government is collaborating with Health Canada to change the rules, making it illegal to use drugs in public spaces. This will empower police to move people along and seize drugs where necessary, including parks, streets, in front of business, and most of all hospitals. British Columbia want our community to be safe and secure, and we're taking action to support it. We're taking measures to ensure hospitals are safe for staff, patients, and visitors. Illegal drug use is not permitted in hospitals, and this new action are intended to ensure that everyone is aware of and heed to the rules. Enforcement measures will be implemented for those who break rules, with support provided by both staff and patient. We'll continue to collaborate with individual hospitals, such as Richmond Hospital, to meet their specific needs. Our government is dedicated to working with healthcare workers, researchers, experts, and the community to ensure that our strategy to save lives of British Columbians are effective and suitable to the needs of the community. Ultimately, British Columbians share the desire for people and community to be safe and secure, and with treatment available for those who need it. I'm proud of the steps we're taking in Richmond to ensure the safety of all members of our community. Let me be clear. Smoking and drug use are not permitted in hospital. We're not designating hospital space for overdose prevention sites in Richmond or anywhere else. We recently hired 320 new security officers at 26 sites. Our government is committed to keeping hospital staff safe and hospital staff, patients, and visitors safe. And we will continue to do so as well.
Thank you, Member.